So, after all of that, false start before lunch, no microphone. Now you're finally ready to go. Please give a big hand to medical pollution.
Hello, I'm Tamara. This is Fisher, Jake, Grace, Rose, and Connor, and we're addressing the issue of medical pollution.
Okay, first of all, medical pollution is generally defined as medical waste and equipment that may or may not be contaminated, and it is distributed improperly into the environment by just throwing it out. The problem poses a large threat to people that are in the vicinity of this pollution because it can contain harmful diseases and pathogens that could lead to illnesses that could be fatal. The problem is generally more present in countries that are developing, continents like Africa and Asia and South America. And specifically, our action plan targets the country in Africa, not the country, but anyway. It targets the continent of Africa, specifically Sierra Leone, where the Ebola outbreak has taken place over the past 2 years. The purpose of our action plan is to attempt to get rid of some of the impact of the medical waste on the environment there and the people. And we're going to do this through sending a team over there.
Although the foundation of medical waste regulations were started by the Solid Waste Disposal Act of 1965 and the Medical Waste Act of 1988, current regulations are spread out all throughout government. For example, the Department of Transportation is responsible for the safety of transporting medical waste, while the Occupational Health and Safety Administration is responsible for regulating the precautions that workers need to take when handling it. A vital regulation is the EPA's cradle-to-grave management of medical materials, which in this, they make sure that the production, use, and disposal of materials is very safe. The problem with this is that since the regulations are spread so far and wide through agencies and administrations, some of the definitions and regulations overlap or conflict. And this means that it's ultimately up to hospitals and medical facilities to decide how they're going to manage the waste safely, which is unclear and a bit inefficient. Another problem is that almost all of the regulations deal with preventing medical pollution from being created, which is definitely not the case. And this leaves a lot of pollution being put out into the world and nothing being done about it.
All right, so the illegal dumping of garbage and household waste has always been a problem. And recently, the dumping of medical waste has arisen. Now, medical waste can be fatal in some cases, such as hepatitis B. And this type of waste comes from hospitals and labs. The labs use it to work with infectious diseases, and from hospitals, it works with contagious diseases from patients. Now, this waste has the potential to start an epidemic. And for example, in Coimbatore, India, it's been a problem in the past decade and has gotten the attention of the Indian Public Health Association, where they're trying to make rules and stricken the policy to keep the public in safety. Now, in Africa, they are known for having more diseases and they're known from having more diseases than their other bordering continents. Now, this is bad. All right, so medical waste there. If it would to contaminate the water, it could make the environment uninhabitable. And through it getting into the water source, it can infect the ground used for agriculture. And with the public coming in contact with this medical waste, it can spread diseases such as Ebola and such. And if we don't take an action to fix this problem, it will create more uninhabitable environments. And for inefficient acts, in 2006, in America, we spent over $650 billion more than other economies or countries. And 91 billion of that was from inefficient and redundant health administration practices. And 30% of Medicare and clinical care spending could be prevented, but have the same outcome. So from the Congressional Budget Office, 30% would equal over $700 billion saved. And from these acts, they're more specifically in medical waste, they're failing for care of delivery, care coordination, and pricing. And they're also having trouble with fraud and abuse, administrative complexity, and overtreatment of medical waste.
So following what Jake said about the compelling issues of medical pollution, I will be addressing the necessary actions that need to be taken to reduce the medical pollution. Most people aren't aware of the effects of medical pollution. However, most are aware of the Ebola outbreak. The Ebola outbreak not only caused several people, thousands of people, to suffer, but it also left the environment in terrible condition. I actually looked up, typed in Google, medical pollution in Africa, and this popped up. Although there are many locations that contain Ebola patients, the Ebola outbreak primarily occurred in Africa. So after the Ebola outbreak occurred, many of the medical tools that were used to help with Ebola were left out in the open without being sterilized, causing Africa to become a quite unsafe place. Instead of choosing to create awareness or prevention, we decided to take a different route. We decided that we would create a program that would travel to Africa and help with the cleanup of medical waste. We would accept 50 volunteers that were willing to travel to African countries. We would pick up all of the medical waste that we could, and this includes syringes, needles, medical bandages, and any other medical waste that could potentially be contaminated. So this is beneficial because a lot of countries in Africa are still developing, so they don't have the machinery that they need to get rid of this waste. So we would help them with that. We'd give them an opportunity to become a safe country or continent. So although this wouldn't end medical pollution, it would help them become an even safer country.
With our 50 volunteers, we would need about a total budget of $150,000. $53,000 total would be spent on plane tickets for all of the volunteers to go to Africa at about $1,060 per ticket. $63,000 total would be spent on food. This would let everyone individually eat for about $22.50 a week. $1,000 would be spent to get 50 tents for $20 each. I know that sounds really cheap, but actually it's real. We would spend $500 on trash grabbers so that it would be safer for the volunteers to pick up trash rather than using their hands. And then with the remaining money from the budget, we could buy a medical waste incinerator, which can run anywhere from $25,000 to $34,000.
Okay. According to the Environmental Protection Agency, medical waste is all waste materials generated at healthcare facilities. According to the World Health Organization, medical waste is a common cause to many infectious diseases. Even in the times of diseases such as the Black Death, medical waste was a problem. There is a factual story about a group of monks who thought they had found a vaccination to the Black Death. They went around with about 3 needles a day, inserting needles into hundreds of people. And the problem with that was that if a person did not know, but they were already infected with the Black Death, their infected, contaminated cells would be on the needle, and that needle would then be put in many other people, therefore spreading the Black Death instead of stopping it. And so the point is improper use of medical waste, like if you just leave a needle out, it can be very disastrous. Medical waste is also bad for the environment. If you throw out your antibiotics just nonchalantly, it could get into the water supply, and that could get into like big water supplies, and before you know it, you're drinking Claritin and Advil, which is bad. There's also bills that have helped with medical waste, like the 1988 Medical Waste Tracking Act and the 2013 Medical Waste Management Act. Those have helped, but laws are still broken across the globe. Our funding proposal is to just simply pick up the medical waste. So mountains and sea of trash and medical litter isn't piled up like that, and it's kind of scary to think about that there's that much trash in the world. And although 50 people doesn't sound like a lot, that can make a big difference over 1 year. And so they're basically just going to pick all that stuff up. We're against medical waste, and thank you.
Would the volunteers wear hazmat suits?
Well, with our budget, there was. All right. Anyways, with the budget, there was a little wiggle room, and we, like with it was the tents, we found there would be a little extra money there, which could maybe go towards hazmat suits, but we're not sure because we would probably end up asking for more money if we went towards hazmat suits and such. Oh, we got two. I'll go with you. Yeah.
Okay, so you talked about how medical waste is like improperly like disposing of this medicine. So how would we properly dispose the medicine to prevent this problem from reoccurring?
Well, the safest way we found so far was with the medical waste incinerators, which was just burning the trash instead of leaving it out in the environment. So, I mean, that's going to kill germs and diseases, viruses, but there hasn't been enough research towards finding a better way than releasing it into the air. So,
Another major problem is that there is no perfect solution to safely dispose of medical waste. And so our goal is to just make sure that it's out of the public's way, and so that it has the least likelihood of infecting the public and getting into society. Yeah.
How would using a incinerator that you purchase be beneficial over just burning medical waste?
Essentially, they're the same thing.
Generally, the incinerators that it would use would be in a more secure environment, because even with burning still distributes certain materials into the air. But incinerators are generally in an enclosed environment where nothing can get away until it's burned.